Hey, hello everybody. Good morning. Good morning. Today is Saturday. It's February 22nd, and we are here on the air live from Planet 11 Radio. This is your host, Mini, and I have with me in this Planet Health new program that we're going to be airing, and with our partners on 102 FM 102.1 and AM 1010. We're going to be today on the air and live, and you can look at us in our social media as well, with Dr. Michael Gellman. Dr. Michael Gellman is a chiropractor, as an expert on the spinal. And
yes,
there you go.
I've been doing it for a very long time, so I better
Very
be an
long
expert.
time. I'm going to introduce you guys to him because he have a lot of information, very important information to share with all of us today. And he has his practice on
It's
Go
on,
ahead.
yeah, it's
It's
in,
in
it's in
Peachtree.
Midtown Atlanta.
Midtown Atlanta. And well, I'm not going to talk much because I'm sure you don't want to hear me saying all these things. You want to hear from him. So here is Dr. Michael Gellman. Tell us about your practice and what you do in your experience in the world of chiropractic and all that information.
Absolutely. So, absolutely. So yes, my name is Dr. Michael Gellman, and it's wonderful to meet everybody here. My practice is called Peachtree Wellness Center. I am on Peachtree Street in Midtown, very, very close to the High Museum of Art area. And I've been in that area for really almost 30 years. I've been practicing for quite a while. Originally from New York City, moved down to Atlanta to go to Life College, got involved with the Olympics in 1996. I was the official chiropractor for the opening and closing ceremonies at the time. I had a secondary office actually in the Olympic Stadium, and that was quite an experience. I'm also a drummer, so I was performing in the opening and closing ceremonies as a drummer as well. Anyway, what we're really going to be talking about today is we're going to be talking about injuries from automobile accidents. And I mean, I see all types of patients because chiropractic is really good for most things. I mean, we deal with the musculoskeletal system, obviously. Where's my spine? Kate, can you bring in my spine for a second? Thank
There you go.
Here we go. This
Yeah, I hold on to this so you can go ahead and
No,
use.
it's okay. It's
Are you okay?
It's
All right.
fine.
Wow, this is so.
This is ancient. This spine is probably older than a lot of you people over there.
He wants me to hold it for
Okay,
you. Okay,
okay.
good.
So, as a chiropractor, we're really looking at your health through the idea of the spine. The spine is not just one thing. It's made up of the skeleton, which is all the vertebrae that you see here, and all these vertebrae are spinal bones that move, they're joints. And then inside, this is very important, inside of these bones, because they're like rings, is a canal, right? And inside this canal, it's called the spinal canal or the central canal, is the spinal cord. Your spinal cord is part of your central nervous system. It's connected directly to your brain. So your brain and your spinal cord make up your central nervous system. If there is any dysfunction with your spinal cord, it's going to affect the functioning of every single aspect of your body.
Interesting.
Your organs, your muscles, your nerves, even your emotional state and your mental state. So when we have injuries to this, we look to see if there are problems with the alignment of the vertebra. We look to see if there is what we call fixations, where the bones are sort of stuck and inflamed in the joints and they're not moving very well. And I kind of use an analogy with my patients that if you have like a rusted machine, like something made out of metal, like a bicycle or something, and it's rusted and it's no longer moving, it's just useless. It's sort of not going to work anymore. And if we want to bring it back to life, we have to put some oil or WD-40 in the joints and gradually start moving it again. Motion is life, okay? The movement of energy, of blood flow. In Chinese medicine, they call it qi, is really what really animates us and makes us alive. So if we have these fixations that could be caused from poor posture, from inactivity, obviously from trauma and injury, then we need to get in there and gradually start getting them to move again, to give back life. So that's where the chiropractic adjustment comes from. It's really designed to get into the spine and find areas of misalignment, of compression, of fixation, and get it moving and get the flow of blood flow and of energy that flows up and down the spinal cord, up to the brain and up to the body, moving and flowing, and have the person really um, working at their optimal best level.
Very, very good, very interesting. And what do you have to say? Because I mean, a lot of people get into car accidents and they say, well, you know, the damage in the car wasn't much. I just barely touched my car. But then next day they start waking up with pain in their back, in their neck. Does that really has anything to do? The damage in the car has anything to do with the impact on the body, on the spinal cord?
So that's a really good question. And since I've been doing this for a long time, I've seen a lot of things that have taught me. I mean, this is experiential learning. When you're a doctor, you're dealing with clinical situations and you're always learning all the time. So what have I learned about that? I've seen patients that have minimal damage to their vehicles, maybe a scratch on their back bumper.
A dent.
Not even a dent, like a scratch. I mean, and the insurance company is going to say, well, this person is just not injured because there's no damage. However, that is a myth. You could have enough force to go into your body to cause something. It could be like a whiplash type injury to your neck, or it could displace the vertebra in your low back. That force is going through you, whether it's a rear end collision or a side or a front end. These forces are going through your body, and depending on many factors, they can cause a lot of injury. And I've seen people have herniated discs.
That's
Discs
correct.
from a minor little fender bender.
Yes,
Okay,
that is
and
correct.
I want to talk about herniated discs because that's a very common and serious injury that we see in motor vehicle accidents.
Yes, definitely. We're going to talk about that. And I want to say that we are live right now with our partners, 102.1 FM, 10 a.m. this morning. This is Dr. Michael Gellman from Peachtree
Peachtree Wellness Center.
Peachtree Wellness Center. I always say it twisted. Peachtree Wellness Center, and he's located in the Midtown Atlanta. He is our expert on spines and spine issues. And right now, please pay attention because he's giving us very important information where there is a myth where a lot of people think that because the accident wasn't really hard or they really didn't hit hard on your car, you are not going to have any type of injuries, and this is completely false. People get injured constantly from these accidents, and it's very important that you go and visit someone that have experience on treating with the spinal.
Can I
Absolutely,
interject?
go ahead.
So a lot of people think, oh, I had a little car accident. I'll get a massage, or I'll just take some Tylenol or Advil, and I'll be fine. Okay, and that's only because they just haven't been through this before and they don't really know. And what I see a lot, not 100% of the time, but what I see most of the time is that people that go untreated from these automobile accidents because they think it's relatively minor wind up developing relatively severe and chronic problems later. Why is that? Because the minor injury that they think they have starts to begin a process of degeneration in their spine. It's like getting accelerated aging, accelerated arthritis.
Wow.
You get all these like all the areas where the impact is just starts. You can see the bones start to even change. They start getting little like spurs on them. And I know this is mostly audio, but I'm going to show this anyway. You get like these like spurs on them, and then the discs that I want to really talk about that are like shock absorbers between the vertebra. There are shock absorbers. They start to thin out, degenerate, dehydrate. They can even herniate over time because they get weak. And this could happen over months or even like years. And that's why it's so important after a car accident to get spinal treatment, to get chiropractic treatment. It's vital.
It's vital. It's definitely very important because once you get these issues not taken care, now you're opening the door to a lot of other chronic problems. Yeah, it's gonna be more difficult to fix, but it's gonna cost more money, more time, and it's gonna take a part of your life.
When I have people come in, Doc, yeah, I was in a car accident like 3 years ago, and I didn't really think it was a big deal, and I didn't really do much, and now I have headaches all the time, and sometimes I get like a radiating pain down my leg, and then what we do is we do an X-ray or we take an MRI of their spine, and you can see literally that there was trauma and they've degenerated, and now they have maybe a disc bulge, or they have what's called spondylosis, like arthritis in the spine, and this is why they're having these symptoms. And it's more difficult now to get them better because it's been there for a long time, it's become chronic. So that's why we really want to get this like right after the accident. We want to start getting you fixed right after the injury. Prevent the degenerative changes from occurring. Prevent all this inflammation from causing damage to your spine.
Well, one of the things that I've heard from other doctors as well is that they say that a lot of people don't get treatment on time, and then 10 years down the road, they start having problems with their neck, with their back, and they don't know what is that coming from. And they don't remember that accident, that silly accident they had years ago, where they never got treatment, and now they are suffering the consequences. So we're here live, guys. Thank you so much for the ones who are in social media, Planet 11 Radio. We are live on the air with the Talk of Atlanta.
Oh,
the Talk of Atlanta, 102.1 10, FM and 10:10 a.m. Well, keep telling us about this. We want to hear some more.
Well, yeah, you're absolutely right about these injuries causing problems for really the rest of your life if it's not treated properly. So I thought maybe we talk a little bit about the disc injury. I think that's a very common injury.
Absolutely, yes.
So let's talk about...
What is it? So people understand what is it.
Well, I know this is mostly audio, but I am holding up a picture of the
But
low
they
back
can find us
here.
on social media.
Exactly. So the disc is made of cartilage. So it's not hard like bone, and it's in between the vertebra. So it's almost like a sandwich. So you have the vertebra, the disc, and then the vertebra below or above it.
Mm-hmm.
Okay, and it's like a shock absorber, and it also creates a space so that the nerves have space to come out. And I'm showing this right here. You can see from the side, and you can see the discs right over here. And this particular model shows them getting thinner and thinner and thinner, which means they're getting sicker and sicker and more degenerated and more damaged over time. And this is exactly what happens after an injury if it's not treated properly, okay?
Correct.
So, what are some of the common things that happen to a disc? Let's think of a disc as a jelly donut, okay? So you have like an outer kind of strong cartilage part to it, but then the inside of it is made of like a fluid, like a water, like the jelly, okay? So if it gets compressed or there's too much pressure on it, that jelly part is gonna squirt out. It's gonna come out, usually goes out the back, okay? And we call that either a disc bulge, a disc herniation, protrusion. There's all different types of names for these types of things, and they're all slightly different. But the general thing that we should know is that the disc kind of, because of the impact, because of the trauma, kind of goes back, and it could either go back into the spinal cord and press on the spinal cord, or it could go to the right or the left and press on one of the nerves that come out. So we have two nerves coming out of the side of the spinal cord, and they're coming out of these little holes, okay?
Right.
So when the disc is pressing on these nerves, what happens? We get radiating pain into, if it's in the neck, into the arms, if it's in the low back, into the legs. You've heard of sciatica, that's radiating pain down the leg. It's numbness, tingling, pain, weakness, and the same thing can happen in the arms. You get tingling in your hands.
Yeah, I've heard that a lot. Tingling the hands and the arms.
Loss of function, weakness, pain. So what's happening is you're getting a compression of either spinal cord or the spinal nerve. And that can be helped dramatically through certain types of chiropractic procedures.
I hear you.
Yeah.
Well, time is flying, and I know you brought us today an exhibition, a complete adjustment.
Oh boy.
We're going to be doing here in the studio a complete adjustment with Dr. Michael Gellman, and I can't wait to see that.
Let's
because
do it.
we want to see the whole effect
Let's do it.
of this adjustment.
Yeah.
Let's go ahead and move this
All right,
around.
let's do it.
Thank you so much, and we are here for the ones who are listening. 102.1 FM, 10:10 a.m. We're also on social media, and you can actually look for Planet 11 Radio and look exactly the adjustment he's about to do in front of the camera. So we do have a model here. What's your name?
My name is Kate.
Kate's going to be helping Dr. Gellman today to do this adjustment, and I'm very excited. I can't wait to see, and I can't wait for all of you to see what he's about to do.
Okay,
And
hi.
I'm going to be with you with the microphone, so
Fantastic.
we can hear you talk. Okay?
Fantastic. So this is a young lady named Kate, and she's going to get a pretty thorough and deep chiropractic adjustment. Okay, so I'm just going to feel a little bit. She told me she has a little bit of scoliosis, which is a curvature of the spine. It's pretty common. So we're just going to kind of like look a little bit over here, feel. She's pretty tight up in her upper back area. She's got some spasms, you can feel that. So we know that the muscles are extremely tight, indicating that there's a lot of pressure in the spine. So, Kate, go ahead and lay on your stomach face down. Just put your head right in there. Perfect. Okay. I'm gonna come down here, Mimi, and I'm just gonna sort of look at her position. I'm gonna look at her pelvis, and I'm just sort of getting some visual information right now. I'm looking at her left shoulder blade. You can see a little bit of scoliosis up in her upper back.
Well, you can see, I cannot.
Yeah. Looking at her leg length right now. Okay, just looking at a couple basic things. Okay, we're gonna get started. Okay. So, kid, I'm gonna go ahead, because we felt a lot of tension in your upper thoracic area, and I'm gonna release this for you, okay? So I'm just gonna let me do all the work. Don't even try to help me at all, okay? So I'm gonna sort of move your head like this. And, let's talk about the noises that you're gonna hear, because you're gonna hear some popping sounds. That is gas coming out of the joint. That's all it is. It's just gas buildup, all right? So we're gonna release all that, and there we go. And
Did you hear that?
that was a good,
Wow,
good
wow,
release.
wow.
And
Unbelievable.
this side's probably gonna be even more important. Okay, let's see, motion. There
Wow.
it is. Okay, perfect.
Wow, unbelievable.
All right, so I wanna go ahead. That released her whole upper back, and now there's a lot of blood flow going in there. There's a lot of movement. There's a lot of energy. She's getting a little bit of an endorphin reaction probably. And now we're gonna kind of take it down a little bit lower. So there's a couple of different ways we can do this, Kate. I'm gonna have you sit at the edge of the table facing the wall, and we're gonna try this technique on you. So sit at the edge and face the wall. Perfect.
How are you feeling?
Good. That felt really good.
We're just getting started.
We're just getting
We're just
started.
getting
Wow.
started. We're just getting started. So I'm gonna see if I can get a little bit lower than what we just did, and then work my way down your mid-back, okay? So first thing is I'm gonna put that like that, and put like
You
that.
you're blocking the camera.
I'm blocking the
Yeah,
camera?
blocking the camera.
Okay. Okay, we'll try to go like that. So tuck your chin, and even when I bring you down, I want you to keep your chin somewhat tucked, okay? It's important that you take a deep breath, and let it all the way out, and come on down. Keep your chin tucked, and, okay.
Wow.
Come on. That was
Wow,
huge.
it's
Yeah.
unbelievable when you can hear the back
Yeah,
crack
yeah.
like that.
A lot of people really like that noise. I actually like the noise. I find it relaxing, and a lot of people like it. It's just gas being released. And doesn't it feel like a release of
It does.
tension and stress?
It really does.
Let's do one more a little bit lower, but we're gonna change your hand position, so you're kinda gonna go like this,
Okay.
and your elbow's gonna go together. That's really awesome. Perfect, okay? And again, take a deep breath. Exhale all the way. Perfect.
Wow.
We just finished her thoracic spine, which is the entire mid-back. All right, I'm gonna go ahead and do an adjustment that you may never have had before, I don't know. It's great for scoliosis because it's just straightening and opening everything. So I want you to lay on your back, okay? So, this is called a washdown. Come up a little bit towards me.
Wow,
Come
whoa,
up a little
whoa,
bit.
whoa.
Yeah, come up towards me.
This is,
Yeah, that's cool. That's perfect.
it's like a strap around your head?
So let me tell you, I used to use a pillowcase to do this for years. I've been doing this for like maybe 20 years with a pillowcase. And then over the summer, I found out that somebody invented this thing to do the same thing that I was doing with the pillowcase. And it just seems to work a little bit better. So let's put your head through the loop and here too, okay? Perfect. Okay. All right. And this is just going to
Wow.
wrap around like that.
You get to see this on the video. It looks very, very interesting.
Let me just fix this a second.
He's holding her head with a strap and something like a holder,
Yep.
like to
So-
pull her head off, kind of.
So this is a traction. This is going to be a traction and then an adjustment with traction, okay? And it's very, very powerful. So
Whoa.
now this table, I'm going to have to probably hold it with my foot because it's a portable table. Normally I'm sitting down when I do this, so just let it go. Take a deep breath and let it go.
Wow.
There it is.
She is.
There it is. And come up and tell us
I
what you
really
felt.
admire what you're doing.
What did you feel just now? What
All I
happened?
heard was a Velcro. Ugh.
Wow.
Did you feel like a like a release? That's what
Yes.
yeah, tell us about what you just
I
felt.
heard that too.
It felt like the top of my spine just like ripped open like a Velcro that was holding it shut. Now I feel taller. Just
There
a
you
little
go.
bit.
Can you imagine
There you go.
the compression that I just got out of your spine? Like
I
you're-
can
you, I mean,
imagine.
you were open. Now all I have to do is adjust your low back and you're done. That's
Mhm.
it. So turn on your side and face me.
Okay.
Okay? And this is such a complete adjustment for you today. You're gonna feel so good. Come out to the edge. That's it. And like that. All right, guys. This is gonna be the very low back area. Think about all the blood flow gonna get into her spine. There we go.
Ooh.
There we go.
Wow.
And one more.
Wow,
Una más.
that ripping sound is.
Don't use those. Ripping is a little bit scary sounding. It's a release of all those joints. It's like thank you God for releasing my spine.
Educate me, doctor. Educate us, please.
This is something that you have to experience. You could watch this and it maybe looks a little bit scary, but if you experience the way this feels, the amazing feeling of relaxation, of being clear in your thinking, of being like your body feels light and you're moving properly, it's an amazing feeling. And drugs can never do anything like this.
That's a very important point.
Yeah, they can never do anything like this. And it's actually truly healing. It's not just symptomatic. There we go.
Wow.
All right, now,
Unbelievable.
let's bring you
This
up.
is really something.
Now,
How are you feeling?
I'm feeling great.
have you ever been adjusted that deeply before?
Not that deeply.
Yeah.
I've gotten like my lower back adjusted more often than the upper part.
Mhm.
Like I've gotten a basic adjustment multiple times, but that was way deeper than I've ever gone before. It was awesome.
I will say that I tailor my adjustments to my patients. Some patients want it lighter and they're a little bit more nervous or a little bit tentative, so we tailor it according to the patient. But most people, once they experience the deep and profound effects of a deep, thorough adjustment like that, there's no going back. I mean, they know that if they have pain, they know that they're gonna come see me and I'm gonna release it, and they're gonna walk out of my office feeling amazing.
Well, we are coming to the end of our time, and I want you to give people out there your telephone number, your information.
Sure. So again, my name is Dr. Michael Gellman, and my office is Peachtree Wellness Center, and my telephone number is, and I'll say it twice, 404-475-0386, and one more time,
One more time.
404-475-0386, Peachtree Wellness Center, and I'm Dr. Michael Gellman, your spinal specialist in the city of Atlanta.
Thank you so much. Thank you guys for the ones that are in social media, who go to social media. I hope you enjoyed this. Thank you for visiting. Thank you, Michael, Dr. Gellman, for being here today in a Talk of Atlanta. You are live right now, 102.1 FM, 10:10 a.m. And also on our social media, Planet 11 Radio. You can watch the video. We're going to have it there replay so you can watch the adjustment. This is unbelievable, really good, and we are so glad we had you here today. So,
Thank you so much, Mindy. I had a great time.
yeah, will you be coming back?
Absolutely.
There you go.
Love
So
to.
follow him as well on social media, Dr. Michael Gellman. And thank you so much, everybody, for being here today. We'll see you next time.
Bye-bye.
Alrighty.
That was good.
Let's get
For
this
my
out.
for my first time.
Videos out.
And
Video.
Kate, you
Oh,
were perfect. You were perfect.
Cool. Thank you.